Hello, my name is Christina Carabello, and I am a respiratory therapist. Today, we will be discussing the importance of communication, ethics, and research as it pertains to the allied healthcare professional. The first topic of discussion are principles of scientific communication. Three principles of scientific communication are clarity, accuracy, and simplicity. All three principles are based on providing information which is clear and easy and accurate for patients and researchers to understand. Second, we will also discuss ethics as it pertains to research for humans. When one is caring for patients in a clinical trial, it is important to understand a few various items. The first item would be beneficence, which is the idea of doing good. Second, non-maleficence, which is preventing harm. These are things that we already do as healthcare professionals. Next, we have fidelity and trust. The importance of the patient and practitioner relationship will provide accurate and well thought out information for the clinical trial. Next, we have personal dignity. It is always important to respect the patient and their rights. Lastly, we have autonomy, informed and voluntary consent. It is essential for allied healthcare professionals to follow the same rules which pertain to nurses and doctors that work in the healthcare field. There is no difference in the rules which are offered to patients and practitioners. They go across the board. While research is being conducted with nurses and doctors and scientists, there is very little research which is conducted with allied healthcare professionals. The reason for this has been shown through a clinical trial that many allied healthcare professionals have a limited education on research. When you go to school for allied health professions, they do not offer that as an option. Second, also there is a lack of training, and which may become a concern for some doctors and scientists which are completing clinical trials. It has been shown that if a practitioner has been offered these skills and is educated, that the information and impact which one allied healthcare professional can provide to a research study will offer value as well as a successful research program. When allied healthcare professionals are working with families and doctors, there is a level of communication and professionalism which should always be conducted. It is important to know that when you're speaking with people, that it's essential to speak in words and phrases which they are able to understand. This removes confusion or any questions that patients, families, or doctors may have. Another form of communication is electronic communication. When one is completing any type of electronic communication inside of a healthcare facility, it is important to make sure that all the information is free of abbreviations or slang words, and also provide a very detailed storyline as to what took place during the scenario. With effective communication, it promotes doctors, nurses, and allied healthcare professionals to assess patients and the situation clearer and more distinctly. It is important in healthcare as an allied healthcare professional to make sure you know your audience, whether it be a doctor, nurse, patient, or patient's family. Make sure one always clarifies information and answers any questions or finds solutions to questions that need to be answered. When writing in healthcare, it is important to provide detailed information, as this is part of providing future healthcare success.